Now, as we mark World AIDS Day on Saturday, South Africa has come a long way since the era of AIDS denialism under former President Thabo Mbeki.
When you ask the question, does HIV cause AIDS? The question is, does a virus cause a syndrome? How does a virus cause a syndrome? It can't.
Now, the fear of HIV-related deaths was so bad in the early 2000s that they were called the dark times for South Africa. Today, the country's HIV treatment program, as you've been hearing throughout this program, is described as a phoenix rising from the ashes. But the impact of those horror years, when HIV and AIDS patients languished without treatment and babies of HIV-positive mothers were born with the virus, continues to haunt the country. Life expectancy has increased to over 60 years after dropping to 54 years in 2010. But experts say we are still playing catch-up, as that was the average life expectancy in the early 1990s anyway. We're joined from our Cape Town studio by Zaki Ahmad, founder of the Treatment Action Campaign, which fought hard against AIDS denialism. Dr. Badrashil Modi is a specialist family physician dealing with HIV and AIDS. Very good to have both of you with us. Zaki Ahmad, remind us what happened in those dark years and the impact that it had on us.
Jane, thank you for coming back to South Africa.
Thank you.
My experience of HIV is probably something I haven't spoken about for a very long time. But what sorry, there's a very strong feedback into my ear.
Okay, we'll try and work on that, Zaki. Sorry.
Sure.
All right, let's bring in Dr. Jürgen Pillay. He's DDG for HIV/AIDS in the Department of Health and is still with us on the phone. Dr. Pillay, you know, looking back to those dark times, those dark ages in the 2000s, the policy of denial, what impact did it have on us?
Well, let me first say that in 2010, when the Minister Motsoaledi took office, one of the first things he did was acknowledge that the virus causes HIV and AIDS, that there is a virus and it does cause this disease. And he immediately set about, with people in the department like myself, to mount a huge campaign first to get people tested and then put people on treatment. And he did as well publicly apologize for the AIDS denialism period. And it clearly had a major impact on both the new infections as well as people dying from HIV. I mean, there's no question about that. Are we still playing catch-up? I think to some extent we are, but we've given the scale of the program since 2010 to date. It's clear that we've made huge strides in catching up with respect to getting people tested and putting them on treatment. And as I think your previous guest has said, you know, testing rates are very high, especially in women and women in the reproductive age. Where we are still struggling is young people who, of course, many of them were not born during the era of AIDS denialism, and men. It's the same problem, though, we have for TB, for example. So, you know, we can see that this is a pattern that affects how people access health services as well. So it's rather more complicated than just putting everything at the door of AIDS denialism, even though we know it's had a major impact and we are still playing catch-up.
Dr. Modi, as a specialist family physician, what have you seen and the knock-on effect of that period?
So it's very interesting what Dr. Pillay is talking about. And we're talking about from 2010 to now that we've done remarkable strides. But we mustn't forget our history.
And it's important.
And it's important because we need to learn from our history. And if you look at 1995, the average life expectancy in the country was around 63, 64. So we're just catching up to 1995, 20 years later. If you look at the number of...
it's nothing really to be excited about, is it? We're just going back to...
We're going back to square one. If you look at pregnant women, HIV incidence in pregnant women, the prevalence was less than 10% in 1995, closer to around 5%. Today, it's stabilized at 30%. not counting all the lives that has been lost unnecessarily, not counting all the children that were born HIV positive that are now on medication for the rest of their lives. So it's been a huge impact. And then obviously we've got people living longer, not dying, but we have to take care of them, which resources that could have been used elsewhere if we didn't have the epidemic to the extent that we have it now. So we had a window of opportunity, late 90s, early 2000, of curtailing the epidemic.
And it was an important time, wasn't it? Because it was really on the rise.
It was just on the rise. And it was civil society that actually drove the care, both on the medical side as well as the legal side, and forcing the government to at least concede to care. It really got implemented after 2008 when Becky left.
Zaki Ahmed, I believe you can hear us now. I hope it's better. You were telling me about your experience and what you saw.
The first thing is denialism is a very personal thing in the first instance, because it's very difficult to admit you have a life-threatening condition that you get from risky behavior in relation to sex. And if that is so for any human being, it's particularly bad for men. And I'm one of those people who initially didn't believe that such a virus could exist. A virus that kills black people, a virus that kills drug users, that kills sex workers, a virus that kills gay people. How can you have a virus like that? And of course, my understanding changed as my friends died, as my comrades started dying, and so on. And tomorrow we'll remember 20 years since the death of Simon Mkhodi. And it was his death that was the catalyst for the formation of the Treatment Action Campaign. And I remember very clearly that year we had seen so many people die. By 1996, people in Europe, in Brazil, in parts of Asia were getting out of their deathbeds because of combination therapy. And the HIV denialism that arose later was not the problem we were facing. The real problem at that time we were facing was the prices of medication. So 1 month's supply of medication would cost you 10,000 rand. At that time, I was earning about 2,000 rand a month, which was a high salary. And we thought when we formed the Treatment Action Campaign that our battle would be against the drug companies. Regrettably, it turned out to be something of a war where President Mbeki declared a war upon black working class people, African, colored, Indian white working class people, and white working class people, by denying that HIV caused AIDS. It wasn't a war fought with bombs. It wasn't a war fought with guns. It was a war fought by withholding resources from the most vulnerable people in order to allow them to die, in order to prove an ideological point, which I don't think should ever be forgiven. Exactly. And it was exactly the point that I started on, that it is so difficult for anyone to admit that a virus could exist that says African people have too much sex and therefore you have to, therefore you will die of this illness and therefore you need medication. And I fully understand that. White people's perception historically of black people's sexuality is just wrong and evil. But to adopt a response to that as a medical response or as a scientific response is a disaster which this country will actually almost never recover from. It had a political impact because it destroyed the internal democracy in the ANC. Together with the arms deal, it shut up Parliament in the ANC, and it was very few people, Barbara Hogan, Mzizi Matlala-Rutledge, Craig's governor, were among the only people who were courageous enough to speak up against Mbeki's denialism. Issa Pahad was a thug and gangster. Alec Irwin, unforgivable behavior. And so when we look back at that period, it was a period in which people were engaged in a civil war against their own government, or the government was engaging in a civil war against the people.
I'm going to stop you there for a moment. I mean, just talk about the devastating ripple effects which we're still feeling. But if we just look at some of the numbers, I mean, our life expectancy numbers are up. We touched on it a little earlier. But it's just a recovery from the drop in expectancy that we had during the Mbeki days. Take a look at this graphic. So we have staggering numbers there, how many people died due to AIDS denialism. That's over 300,000. Life expectancy in 1995, 61.4. And we've only just sort of come back to those figures now. I'm going to show you another graphic about mortality rates for children under 5 between 2000 and 2005. That's the height of HIV denialism in South Africa. I mean, look at how it just, I mean, 1990, I believe that's when the figures were starting to come in, the data. But look at it, at 2000, 2005, how many, up to 50% were dying then. And as we were talking here, Dr. Mori, about the impact now of these families still suffering from that age of denialism. How do we move on from that?
So there's a number, we heard from a number of speakers, there's a financing, there's a health systems, etc. But one of the biggest lessons that we can take from our history is the governance. So the governance of starting from the top, setting the tone. And HIV was very particular where it was blocked from the top. And that's why we didn't get where we are. And have we actually learned from that? And it reminds me of Life as a Dimeni, where it was a governance issue. And we still have in 2018 people dying in our healthcare system. Is our healthcare system capable of looking after people across the board, not only just HIV? So governance is one of the key things that I would suggest that we have to look at. In HIV in particular, we find that the role that Mbeki played and the party actually was the same. And they allowed it to progress for 10 years.
So the shock, the mental impact, the health impact. Dr. Jürgen Pillay, are we in a position now to get better? I mean, our research has improved, our treatment is some of the best in the world. Is that enough?
Well, it's never enough. We need to have a step change and increase a number of things. One is we need to increase information about HIV and how it's transmitted, especially amongst young people, because we don't seem to be winning with young people with respect to how they deal with sexuality. And, one of the key places to do that is in schools. So we need to figure out how to get a more robust engagement at especially the secondary school level. We're going to be providing the best drugs available anyway. We will start with a new drug formulation early next year, which is more tolerable, more efficient, more effective, and will be cheaper than the current regime. We will be doing self-screening. We already have about 800,000 self-screening tests out there, so people can test themselves and screen themselves for HIV. But ultimately, it is really about individuals taking responsibility for their actions, as well as government providing the leadership to provide both the means by which people can protect themselves and get treatment so that they are virally suppressed and don't pass on the virus to others.
So we're really going to play catch-up after being left behind. Dr. Jürgen Pillay, Dr. Badrushil Modi, and Zahi Ahmad, thank you very much. That's our show for tonight. I'll see you at News next.